Well, hello and good afternoon, everyone. Thank you, everyone, for coming back and joining us and just attending ONEgeneration's Health and Wellness Webinar Week. We're just so grateful that you guys are taking the time out of your day to just join us and just learn some more about some amazing topics. For those of you who do not know me, my name is Leanne Cooper. I'm the director of ONEgeneration Senior Enrichment Center, and the organization is led by our president and CEO, Jenna Haas. So this webinar layout will be composed of first having our presentation by our lovely Jennifer here, and then we'll have questions and answers at the end. So just please feel free throughout the entire presentation to use the chat box, to use the Q&A function if you would like to ask a question anonymously. And then there's also a function at the bottom of the screen that says raise your hand. So if you want to verbally ask a question, you can do so by just selecting that button, and then I'll be able to allow you to come in and ask a question verbally to our presenter. So this presentation is being recorded. So this is amazing because we're able to put this into our newsletter. So you'll be able to watch it over and over again. You're able to share it with friends and family, which we would really highly encourage you to do. And of course, you can have the number and the contact information for Jennifer so that you can always just follow up with her and just create that relationship with her as well. So I'm super excited to introduce Jennifer Liptawat. She is presenting on alleviating modern ailments with acupressure. So Jennifer, thank you so much for joining us. We're super excited to have you.
Thank you.
I am going to go ahead and share my screen. Okay. All righty. Let's see. Are you able to see my screen, Jennifer?
Yes.
Okay, so I have you now spotlighted so everyone can see you, and now the presentation.
All right. Hello, everyone. I'm Jennifer. I'm Dr. Jennifer Liptawat. I'm excited to be here. We're going to go over how to alleviate modern ailments with acupressure. All right. So let's go over the agenda for today. So today, I'm just going to give you guys a brief introduction, a little bit biography of myself, and we're going to go over where it all started. So what is acupressure? Where did it come from? And what does it do? It all started with traditional Chinese medicine, all right? Then we're gonna go over the basics of acupressure, some of the tools that we use here at the clinic, the do's and don'ts of acupressure, and what are the best acupressure points. And then we're gonna finally top everything off with the top 10 ailments that my patients go through. And I thought I would share that with you guys. And then finally, we'll end up with the Q&A. All right, you guys ready? All right, a little bit introduction about myself. If you guys haven't seen me around the Encino Farmers Market, I am there every, I would say every 2 weeks at the Encino Farmers Market on Sundays. And I am a board certified licensed acupuncturist and a doctor of acupuncture and Chinese medicine. I'm also the founder of Reboot Acupuncture and Wellness Center in Granada Hills. The clinic is an integrative clinic, and we actually mix both Eastern and Western medicine. Some of the things I specialize in is chronic pain, neurological disorders like Bell's palsy, trigeminal neuralgia, Parkinson's, tremors, things like that. Some autoimmune conditions, thyroid, Sjögren's, diabetes, weight loss, fertility, and women's health. All right, so let's go ahead and jump into acupressure. This all started with traditional Chinese medicine. Acupressure is a modality that we use in Chinese medicine. It's very similar to acupuncture, where it signals the body to activate its own healing and regulatory system. It has been used for over 3,000 years. The use of applied pressure to some tender points on the body helps to correct the functional imbalances of the organs, and it helps to restore the body's own natural state of well-being, what we call balance. So here are some of the tools that we actually use at the clinic. The first tool on top is called an Acupressure Stick. And the second tool, which I have here it is. And the second tool we use is it's called Heskier, which we have here that we use. And these tools you really don't need to have, but it's a nice to have because these handheld devices, when you're using them, it places less stress on your fingers, hand, and wrist. So you're able to last longer when you're applying the pressure. And naturally, as I mentioned, you don't need these kind of tools. You can actually use your fingers. You can use your knuckles. The knuckles are, I use my knuckles a lot. And you can use what I have around the clinic, a capped pen and a highlighter. So if you don't have anything like that, you can use these things as well. All right. So the do's and don'ts with acupressure. So you want to keep in mind that when you start to do acupressure, some of the points are very tender. And so you want to make sure that you're very comfortable. So if you don't want to be standing and doing acupressure, you want to be in a relaxed sitting position, and you want to avoid any awkward movements that can place strain on other body parts. And number two, you want to apply firm pressure with your finger. Usually I use my thumb, or I will also use my middle finger, but I will lace it, meaning I will put my index finger on top of it, and then I will apply the pressure point. And this will help me gauge how much pressure I'm putting on there. So you want to press firmly with your finger for about 3 to 5 seconds on those tender points. And you want to release those points and then repeat it until it's no longer tender. And you can do this up to 5 times a day. All right. So just keep in mind that when you are applying firm pressure, you need to breathe. So when you apply the pressure to a tender area, you must remember to take deep breaths in and out. All right. And take your time. Be patient when you're practicing. Take the breaks. If you feel uncomfortable, take a break and then start up again until your body gets used to the pressure. All right, so now we're going to go over the 12 acupressure points to support your health and well-being. According to Chinese medicine, there are more than 2,000 acupressure points in the body, and we're not going to go over 2,000 of them. We're just going to only go over a handful of the best ones that you'll keep seeing over and over again. You can use these points in conjunction. You can use these points by themselves or in conjunction with other points to help amplify the treatment. All right. So we're going to start off with Yin Tang here. Yin Tang is actually a point right between your eyebrows here. Okay. And Yin Tang is a very famous point. It's actually known as the third eye. And it's really great for headache, for stress, for anxiety, to calm the mind. All right, and then the next point we have here is Heart 7, also known as Shenmen, and its translation is called the Spirit Gate. Interesting, right? Why is it called the Spirit Gate? Well, this point is very powerful. It's located on the wrist here, on the little finger side, and there's a tendon here. And you're going to move inwards, and you don't want to press on the tendon. There should be a spot on here right next to the tendon, a hollow space, and that's where you will press. And this point is great for anxiety, for insomnia, palpitations, depression. This is one of the points that we use a lot at the clinic. We do needle this point right here, and it doesn't hurt. It's one of the points that we use in a combination called the Buddhist Triangle. The Buddhist Triangle consists of 3 points. This Heart 7 here, its neighbor over here, Lung 9, and then there's a point here, right here, called PC 6. And those 3 points help to calm the mind and bring anxiety down. All right, so while we're on the subject of PC6, I might as well show you. Hold on 1 minute, let me take off my watch. So Pericardium 6, that's PC6. The way to locate this point is that you would put 3 fingers, like my 3 fingers right here. The first finger would be right where the wrist crease is. And then you add 2 more fingers. And then you just go over with the 3rd finger here. And it's right in the middle between the 2 tendons. Okay? So that point right there, you can actually use your acupressure tool if you want, or you can use your hand, and you're going to press that. So that point is very powerful. The reason is because it's used in a lot of combinations for motion sickness, for vomiting, for nausea. If you have any stomach discomfort, you can press this point, and you're going to press this point for about 3 to 5 seconds, okay? And then you're going to release, all right? And then press it again. And you can do this up to 5 times until the symptoms have resolved. All right, next slide. So Li4. Li4 is a very common acupuncture point that we use at the clinic as well. This point is very powerful because it's located in an area where there's a lot of nerve endings here, all right? And the reason why we use this point is because it stimulates the nerves to help the organs out. So it's located right in the webbing between the thumb and the 2nd finger. And the easiest way to locate this point is if you take your other hand, your other thumb, and let me see. And what you're gonna do is, do you see this webbing right here? You're gonna take the thumb crease right here and match it along this webbing. And where it lands is where the point is. So then you're going to apply pressure for about 3 to 5 seconds, like I mentioned. And this point is very, very tender. So do not press too hard, okay? And this point is called the hand valley. And it's great for migraine, for stress. We use it a lot for pain in our combinations here at the clinic. And then the next point, we're going to talk about, maybe take my little acupuncture doll out here for you guys. The next point I'm going to go over is Spleen Sticks. This is called Sun Yin Jiao, or 3 Yin intersection. This is where 3 meridians on the leg itself. We have 3 meridians that run 1, 2, and 3 here, run on the inside part of the leg. They meet at this special point called Spleen Six. I also call this point my goddess point, because this point, when you needle it, you will be beautiful forever, okay? So Spleen Six, this point is a good point for all my female patients. And it's located, so to locate this point, what you do is you find the ankle bone, and you're gonna put 4 fingers, you're gonna go 4 fingers up from the ankle bone, and right along the border of the bone there, you're gonna press, all right? And this point is great, as I mentioned, for staying young and beautiful, for anxiety, for insomnia. It's great for painful periods and women's reproductive issues. And the last point on this slide is called GB20, functia, and it's called the wind pool. So this point right here is located at the back of the base of the skull, okay? And there's actually 2 points, so 1 point on each side. And the easiest way to locate this point, I'm going to show you on myself to really quickly. I'm going to turn around. Hopefully you will see this. So the easiest way to locate this point is follow the curvature of your neck. All right, you're going to follow the curvature of your neck until you hit the bottom of the base of your skull. You're gonna move over a little bit to the side, and you're gonna fall into this hollow hole, okay? So it's right here, and it's very tender. It's tender on everybody. So you want to massage this by applying even pressure, and you're also gonna move your fingers in a rotation, okay? Right there. And you're gonna do that, as I mentioned, 3 to 5 seconds, up to 5 times. And this point is great for when you catch the common cold or you're coughing, you're stressed out, you have this headache that goes from the back of the base of your skull all the way to the top of your head. We use that point for headaches and migraines as well, and it's great for insomnia. The next slide. So the next acupressure point is stomach 36. So stomach 36 is it's a famous point. It's a very common and used point in acupuncture. And it is located on this lateral side of the leg right here. So if you locate where the bottom of your knee is, when you bend your knee, there should be what we call the eyes of the knee. You're gonna go about 4 finger widths or 4 fingers below the knee, and you would press into the acupressure point here. This point is tender on everyone because this point is called the Zusanli, which means leg 3 miles. This point is very famous for people who, when they get older, don't have enough energy. And so when you needle this point, or even when you apply acupressure to this point, according to the name, you're able to walk 3 additional miles after stimulating this point, which is quite amazing. This point we use a lot in combinations for nausea, stomach issues, fertility, and in general, we use it as an energy booster and for boosting the immune system as well. Okay, that is stomach 36. All right. The next point is also on the foot. Let's see, how do I do this? So this point right here, I don't know if you guys can see this. It's going to be right in between the big toe and the second toe there. And you're going to pass the first metatarsal bone, and then it falls into this nice crevice. And that crevice is where the acupuncture point is. And so liver 3 is called Tai Chong. It's called the big brushing. Okay. And it's we use it a lot for anxiety, stress, women's issue. Like if a patient comes in and they're irritable, we will use this point in conjunction with Li4. With Li4, remember Li4 was the one that was right here, this point right here. So that combination, Li4 and liver 3, that combination is called the 4 gates. And so that opens up the whole body. It increases circulation to the whole body, and it brings, if you are frustrated, you have a lot of things like going on in your head, it will descend all those emotions down. All right. And like I mentioned, we use it for anxiety, for stress, for women's issue. And then kidney 1. So kidney 1 will be at the base of your foot. Okay. So if the foot is split up into 3 parts, it will be the upper 1/3. So the point would be about here. And kidney 1, it's a powerful point. It's called the Yongchuan bubbling spring, and it's located at the bottom of the foot where the solar plexus is. So if you're not aware of what the solar plexus is, it's one of the chakras. So where this point is, it can reset the whole body. So it will calm down the parasympathetic system, your fight or flight, just by stimulating this point. All right. It's great for insomnia, for grounding, for fright. This point is used a lot for that. All right, next slide. All right, stomach 25. Stomach 25, called Ting Shu, celestial pivot, is actually located on the abdomen. And it is about 3 fingers away from the umbilicus. We use this point a lot for abdominal extension, some constipation. And the way we use it is not only do we needle it, but we also massage it. So it's not just only using acupressure at that point. I will teach you guys how to do a belly massage that will help alleviate constipation, all right? And help with increasing your metabolism so that you don't get bloating, so there's no abdominal distension going on. So that point is very good for that. So let's go back to the hand. Remember I talked about the Buddhist Triangle? So this is the 3rd point in the Buddhist Triangle, all right? This is called Lung 9, Tai Yun, the Great Abyss. And it's located on this thumb side right here. And what you do is you follow the edge of the thumb, and you'll get into, you'll get into where the wrist, there will be a hole where the wrist crease is, like a shallow hole. That's where the acupuncture is. All right. And this is a powerful point, as I mentioned. It's part of the Buddhist Triangle to help with anxiety. It actually opens the lungs so that you can breathe better, and especially helps with any phlegm or cough. It helps with depression, anxiety, and it helps to calm the mind. And this is a good point with Heart 7 and PC6. PC6 right here. So those 3 points are very good points if you need to calm your mind and help relieve anxiety. All right. Oops. And then our last point here is called SI3, which is called Hoshi, and it's called the backstream. Interesting name, right? The backstream. Apparently, we use this point a lot for anything that deals with pain, particularly low back pain. Okay, so the way to locate this point is you would hold your, like a loose fist, right? And then you're gonna feel where the joint, you're gonna follow your little pinky right here, and then you're gonna feel where the joint is, and there will be a hole, a shallow hole right there, and the point is right there. You can actually hold your hand like this and apply pressure, like how I am applying right now. And this will alleviate not only low back pain, but also neck pain. All right, so now we're gonna talk about, it's demo time, right? We're gonna talk about how can we take what I just showed you guys and apply it to the body. So for stress, anxiety, headache, insomnia, I put it in this category. So let's start off with stress. So nowadays, everyone is so stressed out, right? But you can help yourself. So the first point is Yin Tang. Yin Tang is an acupressure point that's located right between the eyebrows, right there, okay? So what you're gonna do is you can use your thumb and you can press right there, or I like to use my middle finger and then I will interlace it with the index finger and then apply a nice pressure. And you can also rub it for 3 to 5 seconds, let go, and you do it again. And make sure you're breathing, okay? So you're gonna do that. Okay, and you can do this up to 5 times, all right? The other one for stress that we needle all the time is called Li4 and Lv3. So these points are called the 4 gates, as I mentioned earlier. So Li4, right, is right here, is right in this hand valley, okay? So to locate that, remember, we're gonna put your thumb, the crease of the thumb, right into there. And then where it ends, that's where Li4 is. And you're gonna press. You can press with your thumb here, or you can use your acupressure tool here, and you're gonna press in there, okay? And then the matching pair of Li4 is Li4. Remember Li4? The one on the foot? The one between the big toe, right here, between the big toe and the second toe, past the first. If you run your fingers between the webbing, between the big toe and the second toe, and you pass, there will be a little metatarsal bone. You're gonna pass that, go all the way up, and then you can't go any more than that. That is where Li4 is, or Lv3, okay? Then you press on it, and you're gonna apply pressure there. So these 3 points, when used in conjunction together, helps to relieve stress. The next set of points deals with anxiety. This is what I mentioned earlier, the Buddhist Triangle. Okay, so I'm going to show you my palmar side here of my hand, and we're going to go and look for pericardium, the Buddhist Triangle. So remember the Buddhist Triangle? Pericardium PC6 is right. Hold on. You look for 3 fingers here, and then it's in between the 2 tendons. Let me get it straight. Right there. Okay. That is PC6. All right. And you can apply pressure there. And you don't want to apply too much pressure because it can actually hurt. So just be gentle, firm pressure there. All right. That is at PC6. And then we're going to move over to the little finger over here. You see this little finger? You're going to trace it all the way down on the side right here until you hit the wrist crease. All right. Once you hit the wrist crease, you're going to move over because there's a tendon that runs right here. We don't want the tendon. That's not what we need to stimulate. Okay. So you're going to move over and then you're going to stimulate that. So that point is heart 7 or HT7, heart 7. All right. And once you're done stimulating that, then you're going to go to the opposite side here where the thumb is. And you're going to go down the sides right here. You're going to go all the way down. And where it drops off on the wrist crease is lung 9. All right. So that is the 3rd point in the Buddhist Triangle. All right. And whatever we do on top, saying on the top of the body, we usually pair it with what's going on in the lower limbs. So going back to my model here, we usually pair it with Spleen Sticks. So Spleen Sticks, remember this one? This is, you got to locate the inside, the inner part of your leg right here. This is where the spleen meridian is. And you're going to locate the ankle, and you're going to go up 4. I know this is not true to size, but you're going to go up 4 fingers, and then it's right at the bone. And then you're going to apply pressure there. That is Spleen Sticks. Okay. So the next series of points, acupressure points, is for a headache. So the first one I showed you guys was GB20. The easiest way to stimulate GB20, remember the one that it's in the back of the head right here, is you're going to interlace your fingers like so. All right. And then, let me see if I can do this. You're going to interlace your fingers, and then you're going to, okay, hold on one second. Let me tie this up. Okay. So you're going to interlace your fingers like so. And then you're going to run your hands along the neck until you fall on the base of the skull, like so. And you're going to feel the hollow. There's two hollows, right? So here's the center, right? You're going to fall off of that center into these hollows, right? And then while your fingers are interlaced, then you're going to apply pressure right there. You're going to apply pressure for about 3 to 5 seconds. All right, and you can do that for up to 5 times. So that's GB20. And as I mentioned, GB20 is really good for headaches that start in this occiput area on the back of the head all the way to the top. All right, it alleviates headaches from there. The other headaches people get is they get eye tension headaches. So on the side of the eyes right here. So the points that we use for that is one, Yin Tang right here. And another point that I have not told you guys yet, it's a special point. We call it Tai Yang. So the way to locate that point is very easy. You're gonna follow the eyebrow or the bone, the orbital, where your eyebrow is, right? You're gonna feel the bone, and then you're gonna go all the way to here, right there, and you will feel on the side of your head that there is a depression. That depression is where the acupuncture point is, or acupressure point is. And so what you do is you can overlay your second finger on your middle finger and then apply pressure. And you're gonna do this on both sides, okay? So, and then you're gonna rub. You're gonna rub in circular motion in that depression. And what that does is that it will stimulate that acupuncture point, and you will feel blood rushing to that area of the eye to help bring circulation back to that area and bring down the headache. So not only Yin Tang, but Tai Yang right there, all right? And then the third type of headache, all right, that my patients suffering nowadays is a sinus headache. Sinus headache, where they feel pressure all along here, and behind the eyeballs, so deep inside. So in those cases, what we do is not only do we stick needles, but I will teach my patients how to apply acupressure to a point called Li4, all right? That's part of the large intestine meridian. So how to locate that point? So where your nostril is right here, you're gonna go out right there, not too far, and you can feel it. If you're very congested, as in congested, or you feel you got some inflammation in the respiratory or nasal area, this point it will be quite sensitive. And you can do it for both sides. You're gonna apply even pressure right there. So we're gonna start where the nostril is, right? At the end of that, you're gonna go right into the crease, right there. All right, and that will help not only drain postnasal drip, but it will help to open up the congestion that is in the sinuses. All right, so next series of points is for insomnia. Insomnia, we usually use kidney 1, So remember kidney 1? So what you're going to do is kidney 1 is at the bottom of the foot, right? So you can use, what I like to do is I'll just use my finger and then rub kidney 1. You can also use your tool too, and you can put pressure right at kidney 1. And if you do this an hour before bed, you will sleep very well. All right. And then I will teach you also the Buddhist Triangle. Remember the Buddha Triangle? Remember the one on the palm? So PC6 here, heart 7, and lung 9, the Buddhist Triangle, like that. It's called Buddhist Triangle. That will also help with insomnia. But I will teach you a very special point. It's called Anming. The literal translation of this point is called peaceful sleep, because it can give you peaceful sleep. All right. So the point is located. Maybe I should show it on my doll here. So the point is located right behind the ear, and it's right behind the ear, and it's just not one point. When I teach my patients to apply acupressure, we actually apply acupressure at the base of the skull here, on the side here, behind the ear. So let me show you that. So what you do is to find that point here, you're going to locate the ear, right? Here's the ear, and you're going to run your fingers. You should be able to feel the base of the skull right here. So what you do is you're going to rub this area from the back of the ear, and you're going to rub, okay? Like what I'm doing right now. You're just going to rub with your, and if you can't sleep, this point is really good for that. I use this myself, and it's called peaceful sleep. Right. The next series of ailments we're going to go over actually uses all the same points. So digestive issues in regards to bloating, gas, fatigue, constipation. These series of points will help with that. So the first point is stomach 36. So stomach 36, remember, that's the one right here with the knee. You're going to go down 4 fingers from where the knee is, and the point is right there. Okay. And you can use that in conjunction with PC6, Spleen 6. So Spleen 6 is right here, and then PC6 is right here. And for this one, I like to tell my patients, this is a very good point when you have any kind of stomach problem. So what you do is, instead of using a tool, right, you use your finger, and it's just not one point. It's a series, it's actually the whole area. So try to find the most sensitive point. If I press here, it's a little bit sensitive. So what you do is you press there until the tenderness goes away. And then if that point is very tender, you're going to go move to the right side of it, and then you're going to press. Okay. And then move to the left side of it, and you're going to press. Okay. And that will cover the whole area for the stomach. And that will bring down your digestive issues like bloating, gas. Very powerful. So you can also work on the area above it and the area below it. So I tell my patients that they can rub this area, and then just rub around. Try to find the most sensitive point, the most tender, and rub that, because that usually will help a lot. All right, and then you can go up here too, like that. Okay, so Spleen 6, the same thing with Spleen 6. That's the point right here, okay, where it's in the inner ankle right here, and you're gonna go up 4 fingers up to the inner ankle, okay? So what happens when you have constipation? I will show you what I do for my patients that have constipation. So I'm gonna stand up. We use a point called stomach 25. it's right on the abdomen here. Don't know. It's right on the abdomen here. And what you do is you're gonna locate your belly button. Mine is right here. My belly button's right here. So you're gonna move over 3 fingers and the point is right there, okay? So you can massage the point in circular motion like this, right? Like so. Or there's an easier way because you can get the whole area, right? So what you're gonna do is with your 2 hands, you're going to take the right hand and then put the left hand on top and you're gonna hold it like this. And you're gonna do a massage. So you're gonna go clockwise, okay? Like what I'm doing right now. So here's the belly button, right? We want to go around the belly button. And you're gonna go clockwise, like so, okay? Now you're gonna do this for 49 cycles, all right? So and you're gonna apply a little bit of pressure, not too much, okay? And you don't need to experience pain. You just want to massage it. And this will actually increase peristalsis and relieve the constipation. So you're gonna do this for 49 turns, going clockwise. And then once you completed 49 turns, then you're gonna go counterclockwise, like so. All right, I don't know, I'm trying to show you guys. Counterclockwise like so. And if you do this every day, your bloating, the gas, the constipation will be gone. All right. All right, the next series of points are for pain. So we're talking about shoulder pain, low back pain, knee pain. This is all treated at my clinic using the hand, okay? So the hand, we're gonna use one of the points that I taught you earlier, Li4. So the thumb goes onto here and then press right there, okay? Right there. Okay. The second point here for shoulder pain, let's start with shoulder pain, all right? So for shoulder pain, we use these points in between the knuckles here. Do you guys see? I'm sorry, like right here, like these knuckles right here, right there. So what you're gonna do is, it's not usually just one point. It's easier if you apply pressure and you're gonna move it back and forth, like what I'm doing now, okay? So these areas right here will cover the whole shoulder, all right? So you're gonna apply pressure like this. And you're gonna rub back and forth. It actually feels pretty good. That means I have shoulder problem. So this other one here, so now I moved over, and you're gonna apply pressure, rubbing it back and forth. And then the last one here, there we go. So that's for shoulder pain. So what do we do for low back pain? So for low back pain, we're gonna go a little bit farther in. So say you run between the 4th and 5th finger, right here, and it's gonna go down to here, right there. So that's an acupuncture point, and you're gonna rub it, hold it, right there. You're gonna do the same thing between the middle finger and the 4th finger. You're gonna run it until you find a tender spot, and that's where you hold it, all right? And then between the 2nd and 3rd, same. And then remember that point that I told you guys, SI3? I use it a lot for neck, and I use it a lot for low back pain. So you put a low fist, run it along the little finger until you hit the joint right there, the knuckle joint, and it's right there, right in that area. And it's a very good point because you can actually feel it, all right? And then Yao Tong Shui is also a very good low back point. It's actually in between this, in between the 4th and 5th finger right here, and then between finger 2 and 3. So it's just right here. And you will feel it. If you have low back pain, it'll be very tender. All right. And then for knee pain, oh, I love this for my older people. When they have osteoarthritis, they have some knee problem. So you take your arm, right? Can you see this? You're gonna take your arm and you're gonna divide your arm in half, okay? And then you're gonna press the points here along the small finger, okay? Right here. And that should help with knee. You can also do it right here and go up too. And you're gonna find the most tender points. And then once you find the tender points, then go ahead and press on it. Hold the pressure, for about 3 to 5 seconds, and then move on, okay? So where you find the most tender points, that's what you will do. All right, that's it for the demo. So now we're into the Q&A. Are there any questions? I did leave my information here. If you guys do have any questions and you would like to talk to me over the phone, or you would like to contact me via email, I left it on there for you. So I'm always welcoming questions. Okay, I have a question for Alana. I'm sorry if I botched up your name. Does Medicare pay for acupressure? Very good question. Medicare will only pay for needles. So they pay for acupuncture and they will only pay for low back pain, chronic low back pain. Can acupressure be used with young children? Very good question. I use acupressure on my kids since they were babies, okay? When my kids would get a stomach ache, I would use acupressure on their legs. So I would be rubbing all along the spleen, like spleen meridian right here. I would rub every night. And what that does is that it helps improve their digestion, okay? So, and then when you do that, you reduce the frequency of them getting sick. Very good question. Any more questions?